Welcome to Connecticut's Health Report. Episode 9, More Than Medicine, Ending HIV Stigma, with Connecticut Department of Public Health Commissioner, Dr. Manisha Jitani. Because being informed is the first step to being protected.
Good health doesn't just happen, it's built. The last time you buckled your seatbelt, did you think about it before you did it? Or turned on the tap and drank the water without a second thought? Or got a vaccine that protected not just you, but everyone around you? None of that happened by accident. Someone fought for it, proved it worked, and put data to action. Welcome to Connecticut's Health Report. I'm your host, Brittany Schaefer, and I'm joined by Connecticut Department of Health Commissioner Dr. Manisha Jitani and Dr. Mercedes Villanueva, HIV/AIDS Care Program Director at Yale School of Medicine, who has dedicated her career to improving care and outcomes for people living with HIV. Thank you both so much for joining us.
Great to be here. Thank you.
So today, we're recognizing HIV Zero Stigma Day, observed each year on July 21st. This day was created to raise awareness about the harmful effects of HIV-related stigma and to promote understanding, compassion, and support for people living with HIV. While medical advances have transformed HIV from a fatal diagnosis into a manageable chronic condition for many people, stigma remains one of the biggest barriers to testing, treatment, prevention, and overall health. So for listeners who may not be familiar with HIV Zero Stigma Day, what is the significance and why is it important that we continue to have these conversations in 2026?
Well, there is General HIV/AIDS Awareness Day, which is December 1st, and that's a worldwide thing. But I think that the Zero Stigma Day is a very special thing. It was founded in 1991 by a South African activist named Prudence Mabeli when she, in spite of much protest, disclosed her HIV status. So it's a very near and dear to the heart of what people with HIV have to go through.
And for many, they feel like they need to live in the shadows, that maybe this is a disease that has certain connotations associated with it. And what we want really people to understand is that there is no disease that should keep you in the shadows, that coming out to receive care, to recognize what may be underlying that disease in itself, none of that is shameful. We are here in the Department of Public Health and as providers in the community to make sure that people can get connected, can take the best care of themselves, because the reality is HIV is a chronic disease now, just like hypertension or diabetes or any other numerous chronic diseases, and we can take care of you. And don't hesitate to come forward because there are so many treatments available.
Now, Dr. Villanueva, when people hear the word stigma, they think of discrimination from years ago. What does HIV stigma look like today, and how does it impact patients and families?
I think it's really important to distinguish between stigma and discrimination. Stigma is really negative attitudes that pervade the society and are really not founded in actual data. Mm-hmm. But they are very strong and very hard to combat. Discrimination is really the visible manifestation of stigma. These are like job discrimination or housing discrimination. These are laws or policies that act on the stigma. And stigma is very, very important. And there's two types of stigma. There's fear-based stigma, where people feel like, I'm going to get HIV because that person has HIV. And then there's another kind, which is blame-based stigma, like people with HIV are immoral. And both of these types of stigma have been around since the beginning of the epidemic. And it's really been something that's plagued people who live with HIV and affects how people decide to get tested or decide to move on with their treatment. So stigma is very difficult to root out. And it's really important that we acknowledge that from the get-go.
Really impacts people in ways that you wouldn't even think of learning face value, but that it has deep roots. Now, as an infectious disease physician, Commissioner, you've witnessed tremendous advances in HIV treatment over the years. How different is an HIV diagnosis today compared to what it was decades ago?
When I was a medical student, I remember doing one of my first rotations actually on the HIV ward, and people would come in with buckets full of pills that they had to take every day. They were huge. They were very difficult to tolerate. And we have now moved to regimens which can be 1 pill once a day that are very well tolerated by many. And there are several other diseases that are much more difficult to manage than HIV. Now, of course, there are consequences of treatment and potentially if you come off of treatment. And a lot of times people are dealing with a host of other factors in their life that make it difficult to engage in care. But the scientific advances have been so dramatic, and we need to continue to combat those other social and societal challenges that we have so that people can really make use of the great scientific advances that we've had. Because sometimes science can advance, but those other factors are the things that make the difference between the person who is engaged in care and living a full, thriving life versus the person who is not.
And Commissioner, how can stigma discourage people from getting tested, seeking care, or staying connected to their treatment?
Well, as Dr. Villanueva mentioned, stigma is pervasive. It is the kind of thing that may not be overtly seen externally, but it's what people feel. And it's what drives people's hearts and minds and their actions and what they will do. So people can feel like others are looking at them differently. They may not want to go to a clinic because maybe they'll be called out for having a certain disease. Maybe friends or family will notice that they are taking some pills. Now, again, 1 pill once a day is a lot easier to conceal than when people had to take 20 pills a day and were nauseous and vomiting and really interrupted their lifestyle on a regular basis. So there are so many things that have happened in terms of scientific discovery in HIV that can make managing this disease so much easier. And so I really just don't want anybody to feel shame for any actions they may have done or any perceptions they may feel others may have of them, because the reality is we are all human beings. We all have made choices in our lives. Sometimes they end up in good places. Sometimes maybe they end up in situations where maybe we do have a condition that we need to take care of, but we have the treatments available to make it such that you can live a full life. And stigma would be the worst thing to prevent people from actually engaging in that type of care.
Definitely. Now, Dr. Villanueva, we've made tremendous advances, as mentioned, not only in treatment, but also in prevention. What should Connecticut residents know about the tools available to prevent HIV today?
Well, just like Dr. Giuttani said, there's been tremendous progress in terms of treating people with HIV, but there's been equally tremendous progress in preventing people from even getting HIV in the first place. And I would like to highlight PrEP, which stands for pre-exposure prophylaxis. This is when somebody who's HIV negative, who doesn't have the virus, actually wants to maintain that HIV negative status. And there are many options to do that. There are pills, once-a-day pills, for example, that if people take the pills once a day, then they can prevent themselves from getting HIV in the first place. But what's really exciting are injectable medications. And we have 2 injectable medications. One is called Apretude, and it is a medication that is injectable, and it's every 2 months. Can you imagine every 2 months to prevent oneself from acquiring HIV? And the newest kid on the block is called lenacapavir, and it is every 6 months. That is amazing because it improves adherence. If people can take a shot every 6 months and prevent themselves from acquiring HIV, that is a powerful tool for stopping this epidemic. And in terms of stigma, I mean, getting a shot every 2 months or getting a shot every 6 months, that is so convenient and so workable in terms of people's lifestyles that has to combat some of these issues of stigma.
That is outstanding. I had no idea that the new option was even out there. Once every 6, twice a year is very manageable. Wonderful. That's wonderful. Now, Commissioner, what is the Connecticut Department of Public Health doing to support HIV prevention, treatment, and efforts to reduce stigma across our state?
So you highlighted many of the features of what we try to put forward in our HIV plan for the state. So prevention is key, as Dr. Villanueva mentioned, and getting as many people who may be at risk for acquiring HIV to understand that there are tools out there like the pre-exposure prophylaxis, and particularly every 2 months or 6 months. Imagine if you take a vaccine once a year to prevent yourself from getting the flu, and here you have a treatment that can prevent you from getting HIV with an injection twice a year. You have this tool available to you, but if you don't actually engage in using that tool, then that's where our challenge is. So part of the prevention key is getting as many people knowledgeable that this is something that's out there for people who are in the community, and for our providers to try to engage as many of those people and get enrolled in that kind of treatment. So that's on prevention. On treatment, our goal is to get as many people that know about their disease engaged in care, because we know that if you're engaged in care and if you are on treatment, we can keep that virus suppressed and prevent you from giving it to others. And then the third is making sure we diagnose as many people as possible. So getting it to be standard of care that people get this HIV test so that they know whether they are actually positive, that's going to be the way that we can enroll as many people into treatment from the get-go.
That is so smart. Yes, please.
I just want to add and emphasize that getting the word out to providers is really, really critical. I've had patients who come in to see me and they've been newly diagnosed with HIV, and this is a preventable disease. And I ask them, why were you not on PrEP? And they say, my provider never mentioned it, or my provider didn't think I could benefit from it. And what a missed opportunity. So I think that for providers getting the word out there, you need to test everyone, and you need to explore PrEP options if appropriate.
So just to piggyback on that, one of the things we're doing right now is a pilot to try to get more PrEP into one of our federally qualified health centers. Because the thing is that Dr. Villanueva and I are infectious disease physicians. So we may see some people who are at risk of HIV, but we would see more people once they get HIV. And so the key is getting more primary care providers comfortable with the idea of prescribing PrEP. Because if they have that comfort, or making a referral to do so if they don't have that comfort. And that is really key, and one of the areas that we are working as a state to pilot with communities where risk may be more, so that we can get as many people engaged with prevention as possible.
That's incredible. And I think such another important step to reduce stigma is even just have primary care providers having this conversation with their patients.
Right.
Now, Dr. Villanueva, what are some of the most common misconceptions about HIV that you still encounter today, and how can better education reduce stigma?
That's a really excellent question. You know, one of the things that we still see, and we are 45 years into the HIV epidemic, and it's hard to imagine that 45 years have gone by. And one would say, oh, we've made so much progress. And yes, we have made progress, but the stigma remains an issue. And I do think this is an area where education is so critical. So, for example, I still see many people who believe that HIV is easily transmissible. And there's an expression that we now use in the HIV field, which is U equals U. Undetectable equals untransmissible. Meaning that if a person with HIV is taking their medications and the amount of virus in their blood is undetectable, they effectively cannot transmit this virus. And so people who believe that they can just get HIV at the drop of a hat, this is really a misconception that we must battle. Another misconception is that people who have HIV have gotten HIV because of blameful behavior. And I have patients who have had HIV for many, many years, and they're actually fine, but they have internalized stigma, which is something that makes them feel less than. And people with internalized stigma, they have high rates of mental health conditions. They have high rates, for example, of post-traumatic stress disorder, depression, and that makes them not want to continue and engage in care. So what a terrible thing when we have fantastic medications, but people feel so discouraged because of internal stigma that they just drop out of care. And that's really a tragedy.
I think that's such a good point. I wouldn't even think about the own internal stigma that comes with that, let alone society who really doesn't understand HIV. I can't imagine having the diagnosis yourself and putting that burden on yourself.
And I think for some people, taking that pill, going to a clinic is a constant reminder, and in some ways accentuates that internal stigma. And so that's why holistic approach to care, including somebody's mental health and physical health when you're getting treated for a disease like HIV, is so important, just to help people come to terms with the fact that nobody is to blame necessarily for why you got this disease, and put that aside and try to move forward with treatment of the condition itself.
We really hope that message is heard today and every day, taken on not just today, but throughout the rest of the year. So as healthcare professionals who have dedicated so much of your careers to caring for patients, improving public health, what gives you hope when you think about the future of HIV prevention, treatment, and stigma?
You know, I've been in this field a long time, and one of the beauties of working in this field is HIV is the quintessential disease where providers have partnered with the community at large. And that is not a given in any disease, you know. So being part of the community is at the heart and soul of working with HIV, and that realization is very important. And so what has that meant? That has meant incredible advocacy since the beginning of the HIV epidemic, an advocacy that is really different and beyond what advocacy has been in many other diseases. And the fact that many communities are engaged in caring for people with HIV, I think gives a perspective that is also quite unique. It is advocacy and a tolerance for different lifestyles and different people who have the disease. And so this kind of sense of inclusiveness has been something that always gives me hope. One thing I do want to mention is that there's something called people first language. And I think that's important, that people don't say HIV victims or AIDS victims. That's stigmatizing, and I still hear that. It's people first, people who are living with a disease that is eminently treatable now. And so I would like to give people the hope that we have a community that cares for people first.
Yes. And Commissioner.
And just to build off of that, in Connecticut, we have a commitment at the level of the state, at the level of providers, to making people feel seen, to welcoming people into that community. And there are always challenges in public health with funding and access, but we know that through support of federal Ryan White dollars and other resources available through the community, whether it be syringe exchange programs, medications available to people, care coordination, mental health services. There are so many wraparound services that are available to people so that if you can overcome that stigma, you can come into a community where you will be cared for. And there is a firm commitment in Connecticut to be able to provide that to people. And we want to try to prevent more people from getting it. So again, our efforts on PrEP to try to prevent people from getting the infection in the first place. But if you do get it, to know that here in Connecticut, you will be cared for. And that gives me hope that despite whatever challenges we may have, we will find a way as a community to come out stronger.
And I think a small call to action step anyone could take today is take something you learned from these two brilliant minds that we've been speaking to and bring it to your partner, your son, daughter, mom, dad. Just bring a little piece of knowledge. I've learned so much today during this conversation, and bring that today to reduce a little stigma. Thank you both so much for this very important conversation. As we've heard today, the science surrounding HIV has advanced dramatically over the past several decades. People living with HIV can lead long, healthy lives and have powerful tools to prevent new infections. But ending HIV isn't only about medicine. It's also about compassion, understanding, and ensuring that everyone feels safe seeking treatment, testing, and support without fear of judgment. On HIV Zero Stigma Day, we encourage everyone to learn more, challenge misconceptions, and help create communities where people are treated with dignity and respect. Until next time, this is Connecticut's Health Report.
Thanks for joining us. Catch the full video on YouTube and stay connected with us on social media for the latest on health in CT. See you next episode.